My name is Dr. Satish Vaidya, and I am a practicing consultant cardiologist in the city of Thane since 1980. I did my DM in cardiology from Grand Medical College and JJ Hospital, Mumbai, and subsequently joined these institutions as professor of cardiology, where I served as a teacher for DM cardiology and examiner for DM cardiology of the Mumbai University. Subsequently, after retirement, I joined Dr. D.Y. Patil Medical College, Nerul, Navi Mumbai as a professor and examiner for DM cardiology of the same deemed university and retired in 2020. The topic of hypertension and diabetes is of great interest to me. Hypertension is described in the literature as a silent killer, but actually in the real world it takes a very stormy course because hypertension complications are very difficult to treat and may prove fatal also. Hypertension affects your body from top to bottom. It can lead to intracranial hemorrhage. It can lead to loss of vision and blindness. In the heart, it gives rise to coronary artery disease and heart attacks, which at times can prove fatal. Hypertension can affect the heart muscle, and we get congestive heart failure, or popularly known as heart failure with preserved ejection fraction, and heart failure with reduced ejection fraction, which many times difficult to treat and may prove fatal. Hypertension can affect the kidneys, producing chronic renal failure, landing up in lifelong dialysis, and of course, peripheral vascular disease. Hypertension and diabetes is the most lethal complication. Diabetes also affects your vasculature and gives rise to accelerated atherosclerosis. So if you get a coronary artery disease, you get heart attacks. If you get cerebrovascular disease, you get strokes. If you get peripheral vascular disease, giving rise to amputations. If you get chronic renal failure, where diabetes is the main cause of morbidity and mortality. And therefore, it is always essential to detect whether you are suffering for hypertension or diabetes and treat it as early as possible, at the earliest, before the target organ damage sets in. Today's scenario, we see a lot of young patients suffering from hypertension and diabetes, and the statistics proves that this is because of urbanization, change of lifestyle, lot of mental stress, lot of smoking, and inadequate sleep, and not taking proper food at the proper time. And therefore, the whole scenario has shifted to younger population. We always recommend that after 30, everybody must check for hypertension and diabetes, because a lot of patients are totally asymptomatic even if they have high blood pressure and uncontrolled diabetes. And these are the ones who really land up with a silent fatal outcome. If you take treatment at the earliest, as soon as it is detected, you can lead a normal, central, and healthy life for even 15, 20, 25 years. And treatment of hypertension and diabetes has become so easy that we have got very good, very potent, very effective medicines having a good efficacy as well as pleiotropic effect, and therefore you need to take one or two tablets which will totally control your diabetes. The newer anti-diabetic drugs like SGLT2 inhibitors are effective for control of diabetes. They reduce your weight, they control your blood pressure, as well as they protect you from cardiac failure. So similarly, there are drugs which are used for diabetes which helps the whole system and postpones atherosclerosis. There are drugs which are used for hypertension, take care of cardiac failure, and take care of diabetes also. So it is my humble request to all the patients, especially the younger population and those who have a strong family history, should every year check up themselves for hypertension, diabetes, hypercholesterolemia, and should canvas against smoking, which adds to the risk factor. And these four factors are totally lethal for these patients, whether it die of intracranial bleed or whether you die of cardiac failure, or whether you die of heart attack, or whether you die of chronic renal failure. So, detection of hypertension and diabetes is a key message that I would like to give to all the patients, and there is no age bar. As young as 30 years of age also should keep a watch whether they are developing any of the diseases which are going to shortly their life.